preparing to live stream the meeting. So that's anticlimactic, but yeah.
Infinite cold. of your peace. Where there is hatred, let me bring your love. Where there is injury, your pardon, Lord. And where there's doubt, true faith in you. Make me a channel of your peace. Where there's despair in life, let me bring hope. And where there's darkness, only light. And where there's sadness, ever joy. Oh, Master, grant that I may never seek so much to be consoled as to console, to be understood as to understand, to be loved as to love with all my soul. Make me a channel of your peace. It is in pardoning that we are pardoned, in giving to all men that we receive, and in dying that we're born to eternal life. Oh, Master, grant that I may never see so much to be consoled as to console, to be understood as to understand, to be loved as to love with all my soul. Make me a channel of your peace. Where there's despair in life, let me bring hope. And where there's darkness, only light. And where there's sadness, ever joy.
Beautiful, beautiful tribute from Dr. Albert Antonio. Hello, everyone. My name is Rochelle Ocampo, and I am a producer and lead co-host for Makilala TV, the first and now longest running Filipino-American TV talk show in the New York metro area. I am also the New York State Executive Director of National Federation of Filipino-American Associations, or NAFA New York, and it is my honor to be your MC for this important event. I'd like to first begin with thanking our key partners in making this event possible. First, the Frontliners Above and Beyond, FAB, National Federation of Filipino American Associations, NAFA, Philippine Nurses Association of New York, PNA New York, Legal Good and Kinding Sindao, with media partners, Now You Know, and Makilala TV. Now, I'd like to introduce Kim Villamere, RN, who is founder of Frontliners Above and Beyond, and who is a person that led the team of Phil-Am leaders in New York in lobbying for more vaccines from the US to the Philippines. She will share the latest info on the COVID situation and where we are from reaching herd immunity. Kim?
Thank you very much, Rochelle. It's an honor and it's my pleasure to be here with you tonight. And maraming salamat to our viewers on Facebook. We're very honored to be able to give you this online session, which will help us reach herd immunity, especially for the Philippines. So as we all know, we need to immunize 70 million Filipinos in the Philippines to reach herd immunity. And let's see where we are at the moment. Emil? So as we all know, we have the United States actually is the biggest donor in COVAX. So we have been receiving a huge amount of vaccines, of doses from COVAX facilities. And so far we have administered about almost 8 million doses in the Philippines. And unfortunately, from January to June 25th, we still have about 1 million confirmed cases and 24,000 deaths in the Philippines, which is quite alarming. And there is still vaccine hesitation in significant amount of the population in the Philippines, and that's why we're here to guide you to answer your questions. So last Mother's Day, we received 2.5 million doses through the COVAX facilities, and we also have received another around 2.5 million doses also around Independence Day. So we have 5 million so far coming from the United States, and we are bound to receive 40 million more apart from the 40 million that the Philippines has procured recently. So that is the situation. This is still not, this is a far stretch from reaching herd immunity. So I urge everyone to get educated, to get vaccinated. Thank you very much.
Kim, thank you. Thank you, really, for your leadership and bringing us all together for this event and for future activities relating to making sure that Filipinos get vaccinated. This is so critical. And it's actually really frustrating that the rest of the world is just like not where we are, and that there's people dying when there's a vaccine, you know, like it's just frustrating for me. So I'm hoping that after today's event, we'll be able to learn more and also encourage our family and friends who are still hesitant to really take the leap after the event. So I'd like to now introduce our keynote speaker, Dr. Christian Castaneda. He's currently a pulmonary critical care doctor at a leading hospital enterprise in New York City, which was one of the hardest hit COVID hospitals in New York in 2020. His team was integral in managing upwards of 7 overflow intensive care units filled with critically ill COVID patients. And his hospital on the whole has seen thousands of COVID patients. He is heavily involved in medical academics with publications and presentations at international critical care conferences yearly. Lastly, he is also very involved with medical education with multiple awards for teaching medical students and medical residents. Dr. Castaneda, welcome.
Thank you for having me. Let me share my screen, or can you enable screen sharing? Is it okay? Miss Amiel. There we go. Okay. And then we will do this. Is that coming through okay? Okay. Good evening, or should I say good morning to those of you in the Philippines. Thank you for joining, and thank you to all of the partners, and especially Kim, that made this possible tonight and this morning. For those of you who don't know me, my name is Christian, and I am a pulmonary critical care physician. That was a very, very nice introduction that you just made. And Kim and I found each other around this time last year, like deep in the trenches fighting the COVID-19 pandemic at our hospital together. I have no disclosures. I have received no funding from any of the companies mentioned in this talk, but it is also important to note that this lecture doesn't provide any specific medical advice, and its contents are purely for educational purposes. I'd like to start with a poignant anecdote from an online physician community that I'm part of, where a young child asked her mom, who was a physician, what does it mean that people fear the vaccine more than the disease? And then the mom responded, people are more scared of the effects of the vaccine than they are of the effects of getting COVID. And in like a true like childhood innocent way, the child said, but COVID can kill you. And the vaccine causes what? Some headaches, maybe nausea. Why would somebody pick headaches and nausea to avoid death? And on a very like foundational level, the child makes a lot of sense, but there's also so much information and so much hesitancy in the community that things like this and opportunities like this are important. And I thank everyone for taking the time to listen to me today. An outline of what we're going to be talking about today, just very briefly. We're going to do an overview of current COVID-19, overview of the vaccines and how they work, and we'll dispel some 5 common misconceptions about the vaccines. And then we'll answer 3 of the most common questions that I usually get these days about the vaccine. It is important to note that I am not an epidemiologist, I'm a clinical doctor. So I will do my best to parse through the journal data that I've reviewed, but I'll do my best. So why are we even talking about this, right? The worldwide travel is restarting. Isn't COVID over? Everywhere on the news, you watch CNN, you watch Fox News, I guess, especially, COVID's over, right? Worldwide travel is restarting. I think a lot of this, the strides that we made are thanks to the strides we've made in vaccination, but in reality, there's still a significant burden of COVID throughout the world. So this is as of June 25th, so 2 days ago, or when I was prepping the slide yesterday. There are 900,000 daily confirmed cases in mid-April. It peaked around there, and then 10 to 13,000 daily deaths. So in my opinion, and I think 13,000 dead daily will tell you that COVID is not over yet, and there's still a significant amount of work to be done. Now, if we take a look at the current state of COVID in the Philippines, as of June 25th, cumulatively, there have been 1.38 million confirmed cases with 24,152 deaths as of June 25th, which is insane. What's even more insane is that the current state of COVID, we've had 600,000 deaths as of June 25th and 33 million cumulative cases. So don't be like the United States, okay? Don't take your 1.3 million and turn it into 30 million. And I think that we have that opportunity in the Philippines to prevent this from happening, because now we have tools in our armament to fight the COVID, to fight COVID, which is namely the vaccine. Yeah. So how do these vaccines work? This is the first question of the day. I'm going to limit the discussion to the 2 most common forms of the vaccine delivery system. There is some nuance with the Chinese and Russian vaccines that I'm not super familiar with because they're not approved in the United States right now, so I'm going to avoid those. The mRNA vaccines, which you've been seeing all over the news, and this involves Pfizer BioNTech and Moderna vaccines. These vaccines encode the messenger RNA, which is a piece of protein that teaches our cells to make the COVID-19 spike protein. And it allows our body to build an immune response without actually infecting the body. Despite a lot of misinformation dispensed throughout the media these days, these vaccines were not rushed into development. They've been available, or the mRNA vaccines have been in development for over 20 years, and they do not contain any pieces of the virus itself. They contain genetic material for our host cells to make the viral proteins. And then once our host cells make those viral spike proteins, our body can build what we call an adaptive immunity to it. In a similar fashion, the adenovirus vaccines do something very, very similar. But instead of encasing the viral genetic material in a lipid, in a lipid capsule, it uses a virus, an actual like common cold virus called adenovirus, and it has that deliver the genetic material to our cells. But once it gets there, it's very, very similar. Our host cells, they manufacture the spike protein, and then once the COVID-19 spike protein is in our body is able to build up an adaptive immunity before it's actually exposed to the strain. So those are the 2 main delivery systems that are in the market right now, the mRNA and the adenovirus. But the premise is the same. The body's exposed to these viral proteins to build an adaptive immunity before it is exposed to the virus itself. which allows us to mount a significant immune response immediately after being exposed to the virus. Now, these are the top 5 misconceptions that I could see floating around the media. And these days, I won't go over them one by one. One is one vaccine better than the other. 2, I already had COVID and I recovered. I don't need a vaccine. And to be honest with you, I developed COVID pretty early in the pandemic last year. And I actually thought about this one too. It's like, why would I get this vaccine if I recovered from COVID? But we'll go into why that's not a good thought process. Number 3, the vaccine will give me a positive COVID test. 4, and I've been seeing this one a lot, the vaccine will alter my DNA. And then 5, one that is actually very, very pervasive, even in the healthcare community, even a lot of my colleagues have asked me about this, is the vaccine will affect my future fertility, which is something obviously very scary. So misconception number 1, one vaccine is better than the other. So this is just inherently false. So even though we're all type A type people here, like everyone that's watching this and everyone that helped produce this is a type A person, everyone wants 100% on all of their scores. On a functional level, the real world vaccine effectiveness is extremely high for all of these vaccines. This is a meta-analysis from a CDC meeting that was performed in I think it was late June or early June, where each one of these lines is a different study on the vaccines, and the vaccine effectiveness is consistently above 80 to 90% with both regards to SARS-CoV infection and then symptomatic COVID. So no matter what vaccine you choose to get, it's going to help protect you. There's obviously a lot of nuances to that statement. And some of those nuances are these. So some of the vaccines, they have different properties, right? So the Pfizer vaccine and Moderna, we know they both require 2 doses. Johnson & Johnson is more convenient where it requires only 1 dose, but then because it's more convenient, the disease prevention is a little bit lower. There's a lot of nuances with regards to vaccine availability, but the end point is that getting a vaccine in and of itself will just help you. And something that is particularly important with vaccine distribution in the Philippines is the storage requirements. So the Pfizer vaccine requires freezers, Moderna vaccine requires freezers, whereas some of the other vaccines like AstraZeneca, which is only available in the United Kingdom, and Johnson & Johnson, they can just take standard refrigeration and they're more stable out unfrozen. In this observational study from Israel by Haas et al., published in May, I believe, of 2021 in Lancet, they show that vaccines are effective in producing a marked and sustained decline of incidence of COVID. So as you can see, as their cases of COVID ramped up on the left side up until around February of 2021, when they started rolling out their vaccine in February and I guess it would be late January, early February, their COVID cases declined significantly. And this is what's being seen throughout the world. Misconception number 2, I already had COVID before and I don't need the vaccine. And like I said, this is something that I sort of thought of for a second as well. This is a misconception though. You still need the vaccine despite if you have recovered from COVID, period. After you recover from COVID, you will have circulating antibodies for sure, but it's unsure of how the immune system handles that antibody response after a natural infection. With vaccination, we have clear evidence and proof that there is a strong antibody response and that you are protected post-vaccination. Whereas we're not sure of that depending on how much after a natural infection. So this is a very common misconception, but you still do need the vaccine if you have recovered. Misconception 3, the vaccine will cause me to test positive. This is one that we see a lot in the hospital because people will get the vaccine and they'll come in, they're not feeling well, they have fevers, and they're and then they'll test positive. This is absolutely false. So none of the authorized and recommended COVID-19 vaccines cause you to test positive on viral tests. The these viral tests are used to see if you have a current infection. There are a number of situations, like a small portion of fully vaccinated individuals will still contract COVID-19. Like I said, the vaccine efficacy is like still, it's greater than 90%, but there's still a small proportion of people that will get it. And then some people, and actually most people, get some mild symptoms post-vaccine, right? So I think most of us here are vaccinated. Everyone had some fevers, some malaise, some injection site soreness. I felt pretty crappy, for lack of a better word, for a day or two after I got the vaccine. So the way that the tests, like the PCR nucleic amplification tests, work to test for active infection, they physically cannot be positive based off of the vaccine delivery systems. And then it's important, I think it's also important to note that it's unclear to how COVID-19 vaccine affects the antibody test, which I remember like early in the pandemic, everyone was getting antibody testing. And it's very unclear what role antibody testing generally has. I don't think it has much of a role at all, which is why people don't recommend it, but it's unclear how those two interact. Misconception number 4, and this one's very popular amongst like the media and like conservative media, I guess it would be, the vaccine will alter my DNA. This is not possible, just straight up not possible. COVID-19 vaccines do not change or interact with your DNA in any way. The mRNA vaccine product actually never enters the nucleus of our cells, and the nucleus of our cells are where the DNA is kept. The adenovirus viral DNA delivery system does enter the nucleus, but it does not contain the protein machinery to integrate into our DNA, only to produce the protein. So it physically cannot change our DNA. But this is a common one that makes people scared, and just makes people scared. Misconception number 5, the vaccine will affect my ability to have children in the future. So this was a very poignant one. Even some of my colleagues in our department, the pulmonary and the ICU department, were a little hesitant for getting the vaccine because of this one. But now that we have a few more months of data, post rollout of this vaccine, almost like, I guess it would be 8 or 9 months of data, there is no current evidence that fertility problems are a side effect of COVID-19 vaccines per the CDC. Obviously, there's ongoing studies, but currently there's no evidence of that. And it is recommended, the vaccine is recommended for individuals who are planning or plan to become pregnant in the future. What if I'm already pregnant? Which I obviously would not be, but there is also, interestingly, no current evidence that COVID-19 vaccination causes problems with anyone who is already pregnant. So I guess 35,000 people in this very early in the pandemic got the vaccine, and then they told the reporting system that they were pregnant after they had already gotten the vaccine, and there were no obvious safety signals. And this was very, very recently. It was published 8 days ago or whatever, 9 or 10 days ago in the New England Journal of Medicine, that the preliminary findings are that COVID-19 is actually safe in people who are actively pregnant, which would be a very, very big deal. But we'll see longer term data for that. But like I said, there's no obvious safety signals. Okay, sorry. Top 3 recent questions that I've been getting. What is this Delta variant? Is this Delta variant is the vaccine effective against this Delta variant? And do I need a vaccine booster? Which the vaccine booster one has been all over the news for the past couple of days. So what is this Delta variant? So as the virus continues to infect the population, it develops mutations, like site mutations in the genome. It's like a genetic drift that alters the viral proteins and therefore how they interact with the cells of humans. Now there's a number of different variants already. I think there's like 3 or 4. But people are scared about this Delta variant because it has possible increased transmissibility, possible protection against vaccines, which has not been proven yet, and then possible increased morbidity and mortality. But I think it is also a victim of being popularized in the media right now, because the truth is that it's too early to tell what the effect is going to be. And there's already studies that are going on to answer question number 2, is the vaccine effective against the Delta variant? So this is not peer-reviewed like journal data, but per Pfizer, their preliminary data shows that their COVID-19 vaccine is 96% effective against hospitalization from the Delta variant after 2 doses. And then AstraZeneca states that theirs is 92% effective. These were from data in the UK where the Delta variant is a little bit more prevalent. But the point is that it's going to take some time to know how, like, to let these studies run and see how effective they are against the variant. This has been all over the news lately. Will I need a COVID vaccine booster? And there was a CDC meeting on the 23rd of June, so very, very recently, that specifically addressed this question. Do you need a COVID booster? The interesting thing is that the latest data shows that only 62 and 65% of people, this is in the United States, have at least 1 dose. So a primary focus now should just be to be completing the 2nd dose before figuring out if this population needs a booster. So we're doing very, very well. We're administering a lot of vaccines, and like the total percentage rates are going up, but people need to complete their 2nd dose, and then we will address boosters. And boosters are currently being studied in a specific set of a population of patients. So residents in long-term care facilities, adults greater than 65, healthcare personnel like us, and people who are immunocompromised or on medicines that make you immunocompromised. But there is no consensus yet. So further data is needed to show this. There are ongoing studies with regards to those populations. For now, the recommendation is not to receive a booster. That could change though. So take home points: get vaccinated. It is safe and effective. Currently commercially available vaccines are all largely similar and effective. And then there is emerging data every day on how these new variants will affect our current recommendations. And some of this stuff could change, but that's sort of just science, and that's medicine, right? Something that was true last year is probably not true now. So you have to be flexible, and you have to sort of just keep up with the literature. And thank you very much for your time.
Thank you so much, Dr. Castaneda. That was so informative and also just easier to digest in terms of all this overwhelming data. You were able to help break it up to a point where I could actually understand it in plain language. So thank you so much for sharing all of that information for us. There was a lot that you covered, and I have so many questions just like streaming through my mind. But I know that we're gonna also get some questions from people who are watching. Before we do go into Q&A, I would like to welcome Dr. Laura Garcia, who is the chairperson of NAFA New York, which is National Federation of Filipino American Associations, and also Dr. Worley Remigio from Philippine Nurse Association of New York, PNA New York, to just briefly share a little bit about the organization. Dr. Laura, you could go first.
Oh, okay. Thank you, Rochelle. Thank you for that introduction. First of all, I would like to thank Dr. Castaneda for that very enlightening talk. I hope, and I'm not only hoping, but I believe that after this talk, there will be more people who will go for their vaccines. And this talk will actually help dispel the fear of getting vaccinated. And NAFA New York is really proud to partner with various organizations for this initiative. I do have a brief message, and this is also in conjunction with Dr. Castaneda's message or talk. And it is this: in partnership with we can do this of the U.S. Department of Health and Human Services and NAFA would like to encourage everyone to get vaccinated. Nagpabakuna ka na ba? Magpabakuna na. Got vaxxed? Get vaxxed. And that is my message for for our viewers or our listeners out there. Thank you so much.
Thank you, Dr. Laura. And Dr. Worley, do you have a message from PNA?
Sure. Thank you, Rochelle. And again, I want to thank our guest speaker for tonight, Dr. Castaneda, for gracing your time. We really appreciate you for sharing your expertise. The Philippine Nurses Association of New York, in collaboration and partnership with various organizations, really stands in appealing to everyone to promote the vaccination. This is the only way for us to protect ourselves, protect our families, and protect our community. And let's continue to clarify those myths about the vaccination. And tara na't magpabakuna. Maraming salamat.
Great. Thank you, Dr. Worley. And Kim, actually, may I ask if you can also share a message on behalf of Frontliners Above and Beyond?
Hello, thank you, Rochelle, and hello, everyone again. Frontliners Above and Beyond, we take pride in our work as frontliners, and we continue to serve the community even beyond our workplace. So this is a solidarity group, and this is an organization of frontliners all over the world who still would like to do more for society, who have been leaders and who are skilled. And Christian, Dr. Castaneda is actually one of us. And thank you so much for being here today and sharing your time and knowledge. And we hope that the Filipinos, especially, we just wanted to give you that message that the Filipino American community is watching over you, that we are here to guide you and support you. And with whatever you need to just reach herd immunity, we are here. Our hearts are never far apart for us to extend our love and support to our kababayans. So get vaccinated, take advantage of all the resources available to get educated as well. And this is one of them. Share the word and, spread the love as well. Thank you.
Great. Thank you so much, Kim. So I would like to now start the Q&A part. Dr. Christian Castaneda, you will probably be the one to answer most, if not all, these questions for us. The first one we have from Facebook is, there are COVID long haulers. And when we talk about long haulers, that means like long-term dizziness, memory problems, headaches. Do we have evidence that they can eventually get cured?
I think it's a difficult question a little bit. The term COVID long haulers, I feel like, is a little general, because there are people who develop COVID and develop like structural problems to their body that are likely irreversible, namely to the lungs. So we know that it can affect the lungs, and we've been seeing people like discharged, and then as they follow up to our pulmonary clinics, they have pretty bad lung disease. While they can get better functionally, they probably will not completely recover from that. But with regards to like long-term dizziness, memory, like I've heard about this COVID brain fog, but I'm not super familiar with it, to be frank with you. So I'm not sure. But from a purely respiratory standpoint, which is sort of my specialty, we do see people who like have sort of permanent damage from it.
And what's really troubling is it's younger people too. People
Absolutely.
feel like that we are invincible because we're young, and we, even if we get COVID, we'll get recovered. But people are forgetting that we are actually, if you do get COVID, you do have a chance of getting long-term effects. And it's not just like, like a simple disease or virus. It's really long-term. So really, again, get vaccinated. A question I have for you, this is me personally, because I've seen and heard from my family and friends this misconception and this concern. So how do we help convince our friends and family members who absolutely refuse? like refuse to get vaccinated because they don't believe in it. They are afraid of long-term effects, like possible misconception, like the misconception of possible infertility. I love that you mentioned infertility earlier. It's something that worries, male and female, because we don't technically know the long-term effects. So how do we convince our friends and family members to take this seriously?
It's a super good question. I think it's a difficult question, right? Because everyone is sort of entitled to their own beliefs, and that's what makes this world great. And then sometimes people don't respond well when you sort of just challenge them with you should be doing this, period. Like they sort of shut down, right? But I think if you approach it with regards to like referencing their loved ones, so the number of times that we see people, and Kim can attest to this, in the hospital or in the ICU who are on life support because maybe like the son or the daughter went to a party or during like the height of the pandemic, or like decided to take a trip like when the pandemic, like maybe when the pandemic was slowing down, because of this mentality that like, I'm young, I'll be fine. But then they go home and then they expose it to like their frail grandmother or their frail mother, and then that mother goes to the hospital. So it's a little bit hard to hammer home how like life-threatening of this disease is until your loved one is in the hospital, and you don't want to get to that point. So I think it's more of like do you care about your family? Like grandma has comorbidities. Like, do you want to see her? Like, then maybe you should go get vaccinated so you can have grandma's pancit or something like that.
Yeah, no, I completely
Yeah.
agree. I feel that there's a point where there's people are saying, my body, my choice. And, in general, yeah, your body, your choice. But if your decisions start invading my safety and my family's safety, then there's a problem, similar to smoking. Like you can smoke, fine, whatever. But as long as you start smoking in front of my baby, we're gonna have a problem. So yes, I definitely feel you on that. We have another question from Facebook. If I have received Sinopharm or Sinovac, can I get Pfizer or Moderna after?
So those are two that aren't available in the United States, so I'm not super familiar with them. My understanding for getting two different doses of the United States vaccines, it's not recommended, like because we don't know if like the delivery systems will interact in a poor way. I would probably recommend against that until there's a little bit more data. So, and I'm not super familiar with those two. I think those are the Chinese vaccines, which are different in their delivery system as well.
Mm-hmm. Another question from Facebook. If I am not vaccinated and I interact with everybody else who is vaccinated, am I safe?
I mean, theoretically, so that's the idea of herd immunity, right? So theoretically, yes, you are relatively safe, but it's also impossible to know if everyone around you is 100% vaccinated, right? So that's this premise of getting to like a certain percentage, like 70, like I know every state in the United States is trying to target a certain percentage before they open up certain things like indoor dining, things like that. So yes, but then it's impossible to know.
Yeah. I also think of it as you're thinking of it of risk. How much risk are you willing to take when you go out to eat, or when you go to a party, or do any activities with other humans? Like you don't really know, and how can you really trust everyone when they say that they are vaccinated, especially now that things are opening up in New York. I still wear a mask, and I've been fully vaccinated since January. So it's really just your level of risk that you're willing to take. Another question we have is, can I still die of COVID if I am vaccinated?
So resounding yes, right? So the vaccines are efficacious to a certain extent, like greater than 90%. And then they also have been shown to temper the severity of the disease, but that doesn't protect you 100%. Like And I think that's why everyone still recommends like maintaining safe social distancing, wearing a mask. Um, Even though the new CDC guidelines are very, very lax with regards to mask wearing in vaccinated individuals, you absolutely can still die of COVID if you've been vaccinated. It's not like a all like invincible shield against COVID.
Yeah, I
Yeah.
actually have that was like a misconception or earlier on when the vaccine just started. People are saying, what is the point of getting the vaccine when I keep hearing people still getting COVID after? So tell us, like, what is really the point of the vaccine if we could get COVID after?
So like I mentioned, it even if you so it decreases your chances of one getting symptomatic COVID, period. Very, very high. Like getting symptomatic COVID and then getting COVID to the point where you need to be hospitalized. And two, if you do get to that point, it decreases the severity of illness. There's some data that it shows that it decreases how bad the COVID you get. Maybe like you won't have like full blown respiratory failure or something like that. So it is still like very, very worth it to get it, despite the fact that there's still like this slim chance.
Yes, absolutely. The key message that I keep hearing is still get the vaccine. Why would you want to risk getting the COVID at a more serious, with serious effects or even death when you get lower your risk? So again, really make sure that you get vaccinated. Another question that we have is, when can we say we are post-pandemic times? Like when is it because when we don't have to wear masks, when we don't have to social distance, like what is that time where we could say post-COVID?
So this question is like very, very, very difficult. And to be frank, it's way beyond the scope of my expertise. Like I'm a clinical doctor, like I take care of people in the hospital. I'm not, there are people who study their entire lives to be epidemiologists and like public health specialists. And they have like computer models for this stuff and they get real-time data every single day. I think that we are making great strides to get to this point, but to declare a pandemic over, I think I'll leave that to like the very, very smart people.
Yeah, I think even Dr. Fauci has trouble answering that. I was going to try to trick you and see if you could get that.
No.
No, I yes, I know that it's difficult to answer that question, and I feel like it's what people are looking for in terms of reassurance that there is an end, that we can get over this. I think that's what we're looking for, and I'm an optimist. I think we can get over this. We just need to make sure our family and friends get vaccinated. Like that's how we get over this. A question here we have is, can air filters and purifiers help prevent COVID?
So the answer to that is a complicated yes. My understanding is that there are papers that show that it absolutely will decrease the amount of like viral contamination in the air and just generally contamination in the air. But it's a much more complicated yes, because there's a lot of things to take into account, right? So what type of air filter you have, if it's like HEPA certified, or if it's like certain grades of sort of like filter, the size of the room, the airflow of the room, things like this. It's like a little bit more complicated of a question than, okay, go out and buy like a $300 air purifier and it'll make you safe. Like I wouldn't rush out and go do that. But I think the general premise is that yes, it can help clean the air around you.
So this is my personal question for you. So I know I was reading your bio earlier that you were managing, the overflow of intensive care units filled with critically ill COVID patients. I mean, can you tell us a little bit about your experience working in that environment? I mean, I can't even imagine what you had to go through, you and your team. Can you share a little bit about it?
Yeah, for sure. I guess I'm not a soldier or have never been a soldier, but I think the best like analogy to it would be like it was like a war zone. There were like countless numbers of like cardiac arrests throughout the hospital every single night. Kim can attest to that, I think. We had like so many sick patients on breathing machines to the point where we were starting to run out of the breathing machines. I know people back in like early 2020 were like worried about that, and that actually almost happened. We had to like call like the storage warehouses to send more. We're putting strain on like our hospital's industrial grade oxygen system. And it was just like an overwhelming, I think the best way to put it would be overwhelming amount of death and misery. So like 30-year-olds dying, 40-year-olds dying. And then like the saddest part about that is that there were no families, right? So because of the high infectivity of everything around, and we weren't sure of anything back then, like there was no visitation. So these people, they were dying alone. So there were young people who were dying alone. Family members were angry at you. You were like pronouncing like 30, 40 people dead every single day. You would like be doing compressions on a patient and then like realizing that like the patient next to that patient was already dead. They just didn't have room in the morgue. Like it was pretty much the best way to describe it was like a war zone. So I think it affected a lot of us like on a very emotional level, but I think that would be my experience, just overwhelming amount. So that's why I don't want anyone to ever have to experience that. And especially in the Philippines where like my understanding is like there's relatively like the resources with regards to healthcare are relatively a little bit more limited than here. Would never want anyone to experience that kind of thing.
Well, firstly, I'm so sorry that you had to go through that. You and Kim and all the frontliners that had to experience that and feel so. It sounds like so helpless that you're not able to really function at your full level because you're just trying to stay human and like do your job. I know one of my best friends, she's a nurse. She, the simple act of like holding someone's hand, just holding, I mean, I'm already getting emotional just thinking of it. Holding someone's hand, their last moments, was the most comforting thing because their family member is not able to be there. So I really applaud you, Dr. Christian, and Kim, and all the frontliners for really sacrificing so much. And I hope people will never forget that. I hope people will never forget the sacrifice that you have all done for us. It's really, it's crazy to think that it was just last year. And now I mean, in New York, I just saw the news earlier today. We have less than, was it 30 deaths in New York, compared to where we had, like you were mentioning, thousands and like hundreds of people dying every day in New York. So I
Like
really,
that's a shift easily, which is pretty crazy if you think about it. Like,
yeah. When I heard that in the news today, I was like, I don't believe it. 30? I mean, 30 is already, no one should be dying of COVID now that we have the vaccine. I feel like that's the main message. And I'm hoping that, people in the Philippines, it's not because you're hesitant to get the vaccine. Now it's more of access. And that's where Frontliners Above and Beyond come in, and partners like you who can help shift supplies to those who need it the most. So Christian, do you have any last words for?
thank you for your time. Yeah, thank you. I'm like, when you guys approached me to like try to give a talk, I was like, I don't know if I'm like qualified to do this, but it was fun trying to prepare. I learned a lot, and I hope you guys learned something too.
Great, thank you.
Cool.
So I would like to now bring it to a close and just thank all of our partners for making this event possible. Frontliners Above and Beyond, National Federation of Filipino American Associations, Philippine Nurses Association of New York, PNA-NY, Legal Good, and Kanding Sindao, with media partners Now You Know and Makilala TV. And of course, special thanks to our tech person, Amiel Siyosioko. Good night in the US and good morning to all those in the Philippines. Thank you so much. Maraming salamat.
sa kanyang palad, nag-alay ng ganda at dilag. At sa kanyang yumi at ganda, dayuhan ay nahalina. Bayan ko, binihag ka, nasadlak sa dusa. Ibon mang may layang lumipad, kulungin mo at umiiyak. Bayan pa kayang sakdal dilag, ang di magnasang makaalpas. Pilipinas kong minumutya, pugad ng luha at dalita. Aking adhika, makita kang sakdalayan. Ibon mang may layang lumipad, kulungin mo at umiiyak. Bayan pa kayang sakdal dilag, ang di magnasang makaalpas. Pilipinas kong